so welcome to DAP's podcast.
Thank you for having me.
Yeah. If you want to introduce yourself and let us know who you are, where you work.
Absolutely. My name is Kaleena Burkes. My pronouns are she, her, and I am the director of the Office for Missing and Murdered Black Women and Girls.
All right, awesome. And I'm Denise. I'm the executive director at the Domestic Abuse Project.
And I'm Denise Covington, and I'm a therapist at the Domestic Abuse Project.
It's really great to have you here. We're really excited about this new office and all the work that you're going to be able to do. Maybe we can start by having you talk about how your office was established and how severe you all feel like the issue of missing and murdered Black women and girls is in Minnesota, in the community.
Absolutely. That's a great question. So back in, I want to say, 2021, the legislature passed legislation to create the first task force for missing and murdered African American women. And so that task force was designed to study the issue in Minnesota. And after studying not only Minnesota, but the rest of the United States, we found out that there are over 60,000 missing Black women and girls across the U.S., and hardly any of those cases are receiving the attention and the resources that they deserve. And so back in the summer of 2023, the legislation was passed to create this office with bipartisan support because the issue is pretty severe. The office is designed and is pivotal to creating systemic change and to address the gaps across the state enterprise. And so we're eager to start the work.
Yeah. Well, it's great to have you here.
Yeah. What type of services and support does your office provide?
So we will provide technical assistance to law enforcement, so aiding families and community through law enforcement investigations for missing persons, as well as for victims of homicide. We will also point family members and victims in terms of therapy, resources that they may need. We'll also get out and do some community education, so training on what to look for missing persons, training on domestic violence, training on human trafficking. But we'll also do some training and conversations with law enforcement because we need to change the narrative around Black women and girls being seen as victims.
You said support families when there is a homicide. Can you say a little bit more about what that might look like?
Absolutely. So there are times when families get back information about what happened or circumstances around their case that they may not be pleased with. So we'll do a little bit more digging and research into those cases to help them process what has happened.
Okay, great. Why is violence against Black women and girls such an epidemic right now?
I would argue that it starts with colonization, racism, and enslavement. We haven't been seen as human, and we're oftentimes not seen as victims. The adultification of children, being seen as adults when they're really vulnerable at young ages, and just the lack of media attention around the issues that faced our communities. But some of the research has uncovered that perpetrators target Black and brown girls because they know that they may not get sentenced, or if they do, their sentence will be less severe.
Yeah.
I want to bounce back to something that you just said from the last question. You were talking about through the trainings wanting to change the narrative. Can you build that out a little bit more and share with us how you would describe what that narrative is right now?
I think right now we are seen as criminals or antisocial as opposed to victims. Like, we are not seen as vulnerable. And so we need to change that for the community, but also for law enforcement, that when someone goes missing, that they are indeed a victim. Like, we don't blame them because of their circumstances. But changing that narrative, not only for law enforcement, but our community members and folks who don't look like us that may see us in a negative light, just to guide and educate people on all lives are valued and we all deserve the resources and the attention needed to find us when we're gone missing.
Yeah, we were actually in our last podcast talking about this with Sam Simmons. And part of what came up in relation to domestic violence is even having African American women feel like they can look at themselves as victims and experience that side of their story so that they can dip into their own healing, and how complicated it actually is to be able to to just hold that for a minute instead of having to hold everybody else's everything.
Absolutely, because how many times are we given the space to actually be vulnerable? Like, that is uncomfortable for most of us.
That's right.
Because like you said, we're carrying everything for everyone else, and sometimes we don't know how to sit with our own vulnerability.
That's right.
We're expected to solve every problem, even our own. So being vulnerable, you're still, if you label yourself as, okay, I'm going to be vulnerable, I'm a victim, and embracing that and being able to heal, you're still criticized for it.
Absolutely.
Yeah.
And all that's tied all the way back to historical trauma, slavery, and rooted in all the things. So something that we're aware of at DAP and see firsthand is the way that BIPOC communities are disproportionately affected by domestic violence, particularly Black and Indigenous communities. Can you speak on, from your perspective, why this is the case and what kind of culturally specific solutions might be necessary?
Yes, why is this the case? And just to briefly touch back on what I said earlier, like this is sort of structured or situated in systemic racism, economic disenfranchisement, intergenerational trauma. That created unique vulnerabilities for our people, as well as Black people and Indigenous communities. Factors such as over-policing and underprotection, lack of culturally affirming services. It means many of us and many survivors and victims are left out of the story. We face compounded barriers when navigating these systems and seeking help, including mistrust of law enforcement. Mainstream systems have historically failed and harmed us. So culturally specific solutions are necessary to address these unique experiences that our community needs. And our office is dedicated to doing that and funding, new organizations or older initiatives that are designed to focus on those unique barriers and assisting us in areas that we haven't been helped before.
Are there specific unique barriers that you can share or talk about? Like what some of those things might be?
I think the Missing and Murdered African American Women Task Force named a couple, and one of those being that there are numerous domestic violence initiatives and agencies across the state, and some of them do not focus on the specific needs of Black women, whether that's shelter or access to job programs, more funding situations. But I think that, once again, going back to us having to be seen as human and being met with empathy so that people can actually tap into our needs, to name a few.
What would you say are additional measures that are necessary for addressing and reducing violence against Black women and girls?
I think we need to invest in sort of long-term community-led initiatives that focus on prevention as well as intervention and healing, addressing the root causes such as economic instability, as I mentioned earlier, housing insecurity, and the lack of mental health resources. I would say mental health is really critical now, not only for the Black community, but for us all across the country. But we need culturally specific programs. And I highlight mental health because I think it's always been a stigma in our community, and we don't talk about it enough. And I know that people think, oh, if I go to therapy, it's a weakness. But no, it's actually a superpower for you to address your own healing journey and try to take, a couple of steps forward. I think policy change is another area, and I think that's what we tapped into when the legislature created this office. But we need to work collectively across the state enterprise, multiple agencies, not just the state, but the county and the cities, to address this from a holistic perspective as opposed to doing our work in silos. And I would say one of the biggest issues or concerns is raising public awareness. Many people right now don't know that the office is here, but I've encountered so many people that did not realize that this was a problem specifically for Black women and Black girls. And so we need to continue to educate everyone and put these stories out there, and this podcast will help us. But we need to let people know that this is an issue and that we're working hard to tackle it.
So you talk a lot about community engagement. And so what are some of the ways that you are engaging with the community and letting them know you're out there?
Yes, we are doing that through numerous avenues. So we are holding a monthly meet and greet with myself and staff at Latunji's Palette, just for community to get introduced to the office, the work of the office, but also to share their ideas. I attend regular meetings with the African American Leadership Council and meet with also other stakeholders there and tell them about the work of the office. But we're also hoping that community organizations will reach out to us and invite us to their meetings, and we can invite them to the office just to brainstorm and talk about the issue as a whole. We're also working with the Department of Public Safety, Office of Communications, to be more strategic and to get the word out across the state, because we know that this is not just a Twin Cities issue, this is a state issue. And so we also want to get out with community across the state in other areas. So those are just a couple of ways, but we're also taking more ideas of how we can engage with community partners.
Yeah. So what, as community members, can we do to support what your work is and what the office is doing and raise awareness?
Absolutely. One is to share information, share that the office is here. I always tell people, I notice a Black girl goes missing every day, and the way that I find that out usually is through social media. I see that someone's gone missing, and so not only can you share that post and create more awareness, but if you're friends with the person who made that post, share the office's information, let them know that we're a resource, but also invite us to community events. We want to get out and we want to educate people, but to also continue to learn about the issue. Make sure that you know where your loved ones are, whether that's sharing your location or just notifying somewhere of where you're going. But something that we've been telling people is to make sure you have updated photos of you and your family members, because those photos are going to help us greatly. And when someone goes missing, notify someone immediately. There is a myth that there is a 24-hour rule in filing a police report, and there's no waiting period in Minnesota. So as soon as you know that your loved one has gone missing, make a police report immediately.
Right. So let's say someone goes to the police and says that someone's missing, and they get feedback that they should wait a little bit longer.
They have to take your report.
So encourage them to push back.
Stay and file a report. They have to take your report.
Okay. Yeah. Great.
I think that's important because of what you mentioned earlier, like the distrust in police and the system, and feeling like discouraged if they do push back. So remembering to keep your voice strong and you'll be heard eventually, hopefully, is an important message.
Yes, and I do encourage, push sounds a little hard, but push, because they have to take your police report, but also, like I said, share information about the office. We do need a police report number, but if you reach out to us, we'll help you walk through that process. But we want you to push, because there's no waiting period.
Yeah. I would say as advocates too, like if you go to the police and you're having a hard time getting them to listen, then an advocate could also go with you to help you file that police report.
Yeah.
Because sometimes folks will just listen differently when a community agency is coming with you.
Yeah.
I'm curious about, like, given the current political social landscape, and the difficulty around talking about race specifically, I'm wondering about what that impact might be, given that your office focuses specifically on the African American community, and what those challenges might look like, and also how the community can support your office, given that there are very real needs and differences between the way that the African American community is being acknowledged and treated, just like you just shared, versus other communities in Minnesota.
Actually, that's a great, very, very great question. So what I will say, just to hopefully give some people some comfort, is that the office is funded by the state of Minnesota. So right now we don't have any federal funding. But in terms of us directly supporting the Black community, this is a public safety issue. No matter your race, color, ethnic group, it is a public safety issue. And so to help support us is that you keep highlighting the stories and you keep pushing, because all we're asking for is similar treatment as every other group. And so we keep pushing. The work doesn't stop because of the political climate.
As far as, like you talked about navigating with different community and system partners, I'm curious about how, I'm curious about how those relationships have been going and what some of those, like, what are some ways that you would hope systems will partner with you around making some changes? How is it that you want the system to show up for your office?
Honestly, show up through positive collaboration. And so there are numerous agencies across the state that this issue directly or indirectly touches, whether that is Minnesota Department of Health or Department of Human Services or the new Department of Children and Family Services, I believe. We just need to work together. We need to stop working in our silos. And a lot of it will be around prevention work. Because a lot of the issues that I believe our Black women and Black girls are facing could have been stopped if they gotten the resources they need. So show up, be curious, be ready to roll up your sleeves and do the work. We know that a lot of this is around law enforcement, and that is also going to have to be positive collaboration. You know, come to the table willing to understand that the perspective is different from yours, and that we've walked this life and we know that there's disparate treatment here, and just be open to helping people who don't look like you and hearing stories from their vantage point and believing those stories as opposed to creating your own narrative. So just show up to the table and be curious.
Love that. Being curious is a very powerful, powerful way to show up. I'm curious about, like, this issue has been going on for so long, and the office just started. So I'm curious just what your thoughts are on that and why you think it took this long for the office to get started.
I think it took that long for people to come together and agree that this is not just it's not a race issue alone. It is a public safety issue. And so if we want to talk about keeping Minnesotans safe and for them to have a decent place to live, then this is an issue that we have to address. Like, do we want all of our residents and constituents to be safe? And if that's the case, then it took them this long to agree on that, which is the hard part. Our ancestors have been fighting for this for decades and hundreds of years. And so in my short lifespan, it seems like a long time, but it's much longer than we're even thinking about. But we're a resilient people. And so we've continued to fight. And so the fight hasn't stopped. And so at some point we were going to get to this place. I just hope that, you know, community is sort of patient with the office because there is a lot of work to do. There's tons of work to do. And it is going to take some time, and I hate hearing that myself, but it's going to take some time to lay the groundwork to actually make effective change.
Actually, that's just reminding me of something that our team read yesterday. Once a month we have like a reflective practice meeting, and our team read this article that was written in 1980, but it was it held true to today, but it was a Asian American woman who was writing a letter to her mother, and it starts out with her asking her mother to show up for her in different ways. But the story, like the letter goes on to be her reflecting on all the things that her mother did for her and like survived and gave in order to build her up to be where she was. And like one of the takeaways was that it might seem like not enough is happening, but there were so many things that had to happen to get to where you are right now. And it's like the building blocks for you to be able to do all the things that you want to do, and to not forget to see those things and have appreciation for them. So thank you for reminding me of that. It's a good thing to remember. So change happens very slowly sometimes.
Very slowly. Especially, that's what it feels like when you're in it. It's just very slow.
Yeah.
And we're not at step 1 right now. We're at step, whatever.
Yeah.
But step 1 happened a long time ago.
Yeah.
And just honoring the martyrs that came before us and those who sacrificed their lives and are no longer with us, and keeping them in the memory, and how many people have fought for them for so long. And the fact that this office is here, like, that's progress. That's
to be
amazing.
celebrated, for sure.
It is progress. And I'm grateful for everyone that put the work in to create this office, because it, like you said, it didn't. This is not step 1.
Right.
So as a domestic violence organization and thinking about the domestic violence field, are there specific things that would be helpful for us to do to support your office? And thinking about doing work with victim survivors, and our organization also works with folks that use violence. Any thoughts, feedback?
You know what? Yes, because I think that we need to hear more Black and brown voices, their survivor stories. How did they get into those situations? It wasn't their fault, but what were the unique situations that led up to them being a victim survivor? And hearing those stories, because I think that's powerful for the people who are doing the work and needing to understand the unique challenges that, we face culturally, but just listening to the people that have survived these horrific stories.
Okay, last question for you. I am wondering whether your office would consider African American women who are going to hospitals to give birth and not getting access to medical care as part of the epidemic of African American women being murdered.
Absolutely. And so to go back to the Missing and Murdered African American Women Task Force report, that was one of the subject matters that they discussed, is disparate treatment in hospital settings. And so I absolutely think that is a part of the larger issue. How to tackle that issue is, we're still trying to figure out the pieces, but it's definitely a part of the issue. And I'm just going to mention like a documentary that I watched with Serena Williams, and to her talking about her childbirth. She was very vocal about the fact that had her white husband not advocated on her behalf, that she may not be here with us today.
That's right.
And so we do have to not only look at this from sort of a public safety issue, but just as a global health issue, is like, how are we treating Black women and Black girls in various spaces?
And this makes me think about changing narratives, or maybe expanding narratives. I'm full of stories about our reflective practice meetings at DAP, but we were having a conversation. We were reading Resmaa Menachem's book and having a conversation around policing. And we challenged ourselves to think about ways in which we were othering and other ways that folks engage in discrimination. And it led us to look at mortality rates of women who were going to the hospital to give birth. And what we found was that while, like, George Floyd era and before, there were more deaths by policing against African American folks than there were women that were dying in hospital settings, that the women who died in a hospital setting surpassed the number of people that were killed by police officers. But the difference is that deaths by police officers are highly visible. They're online, social media, and the news. But when a woman dies in a hospital because they're not getting access to the medical care they need, that's not something that everybody hears about. And so I think both are terrible, but only one gets airtime, and therefore the community really is in an uproar about it and pays a lot of attention to it. But there's this whole other community that absolutely responds in a way that is rooted in racism. But I think it's harder for people to see somebody with a doctor's jacket on as having the capacity to harm someone to the point of death than it is to see someone with a police officer's uniform.
And I think media is starting to pick up on the childbirth aspect of it, but I think what also is lost is just like the psychology around how Black bodies experience pain, and also sickness and what health looks like, and the disparities in the actual care that Black women and Black men and Black bodies are getting in hospital settings, even going in for, the flu and being believed. And so I think that's all related in just the experience of the vulnerability and getting the care that we deserve.
Yeah.
And just to tag on to what you said, like believing people about their vulnerability and their pain.
Yeah.
And so I mentioned earlier, like, we need to believe victims, but we also need to believe people who are going into doctors' offices and hospitals about their pain.
Right.
Like, I know my own body, and I know we are oftentimes seen as super women, and sometimes we have to show up in that space as such. But if I'm telling you I'm hurting, I need you to listen and believe me.
Yeah, you don't have to have your knee on someone's neck to not hear them say that they can't breathe.
Absolutely.
Right?
Yep.
So just a thing for all of us to be thinking about.
Yeah.
Like, we have our own bias around whose bias we see.
Yeah.
Yeah. Anything else you want to say?
We're here. We're ready to do the hard work. We want the partnership. And I value the voices of the community because they know what they want. And so I'm open to hearing those voices. I'm an email away. And so reach out and be prepared to partner with us.
And speaking of being an email away, how is it that folks can get in contact with your office?
Absolutely. So you can go to the Minnesota Department of Public Safety's website. If you search MMBWG in the search bar, you'll find our website. Our email address and our phone number will be on there as well.
And we will put your website on our screen.
Thank you so much.
Yeah. Well, thank you for joining us. It was lovely to have you.
Absolutely. Thank you for having me.
Yeah. We're so excited about your office, and we will look forward to partnering with you.
Great.